Welcome to the Simplified Dentistry podcast. Join us as we discuss clinical, operational, and financial aspects of your practice, help you enjoy life, and dare to simplify dentistry.
Hello and welcome back to the Simplified Dentistry podcast. I'm Dr. Mustafa Shakan, and along with my brother and co-host, Dr. Mortaza Shakan, we would like to introduce today's guest, Dr. Rick Workman. Dr. Workman is the founder and executive chairman of Heartland Dental, a world-class dental support organization that provides support to over 2,700 dentists in 1,700 offices. Dr. Workman has been a pioneer and has made significant impact upon our profession by introducing practitioners to potential opportunities of high-quality, non-clinical administrative support to practice dentistry. Dr. Workman, thank you for being with us today.
Well, enjoyed being here and looking forward to the conversation. Thank you.
Dr. Workman, you've had a remarkable career and a remarkable journey, and you've been very impactful on the profession. Tell us a little bit about your journey.
Sometimes people want to know that, first of all, I did not set out to found Heartland Dental, and I never dreamed it would be what it is. I started out, a lot of people do know I grew up on a farm in a small town, went to a 3-room grade school, had 6 in my class. But I started out, I was looking for a job right out of dental school in 1980. They'd pay me $25,000 a year. Couldn't find that job. I'd heard of a place I could rent in Effingham, Illinois, which is near where I grew up, a big town of 12,000 people. And I could rent the office for $125 a month, 2 chairs. And I borrowed $32,500 from my parents and grandparents and set up a practice. And I didn't know if I'd make it. I literally didn't know if I'd make it, but I thought I could always work on the farm if dental didn't work out. But dental worked out pretty good. And I loved dentistry. I practiced, compared to working on a farm, it was easier and more productive. And so I started out working 50 hours a week, and then I spent about another 25, 30 hours a week. I don't want to say forever, but for the next 15, 20 years, trying to figure out all the things you need to do to become a better dentist, a better leader, how to maybe buy supplies better, design offices better, and work on leadership. And through stupidity, ignorance, and just plunging head, I got more experience at all of those, and over time began to figure out that as dentistry was changing, becoming much more diverse, cost of education was going up. My total tuition was $5,000 total tuition. And I thought, boy, when it gets to $25,000 a year, I don't know how these people are going to make it. And so we got to offer them to find a place where they can come in and join. And today we know that 20% of all grads have over 500,000, another 20% have over 400,000. So it's just been a journey, and we're just trying to solve problems such that dentists would choose to want to work with us and choose to want to stay with us. And, I'm sorry, I got lots to say, but our model.
We want to hear from you.
Yeah. Well, our model only works so long as dentists want to work in a supported office. To the extent they want to work in their own solo practice, great. To the extent they want to work in military, great. FQHC or whatever, great. My goal is pretty simple, is that any dentist should be able to practice at whatever level of support they want with no professional disparagement. Seems so simple.
Yeah. Yeah, it's interesting. Awesome. You say your cost of dental school was $5,000. When I graduated in 2002 and from Chapel Hill, and they estimated our total cost was $35,000 for 4 years, which wasn't a huge crazy jump considering time. Then
when I graduated, I remember mine basically I graduated 12 years after he did. And it had doubled. And then I looked at the data last week for the incoming class at the University of North Carolina School of Dentistry. On average for in-state, it's planned on $100,000 a year.
A year?
So they're going to be walking out with $400,000 at least. The out-of-state kids are going to be paying more.
Yeah.
It used to be when I applied to NYU was the only one that had that kind of a number.
Yeah.
And
no,
it just keeps, it's just these kids walk out of school. I mean, I was one of those guys too. You walk out of school and you're like, oh, I have $250,000 of debt. I got a
500
job.
like you're talking now. Yeah.
Yeah, you get a
So,
job that's not paying you a semblance of that number. You know, you have a family, all those other things. I mean, it's making it hard to justify the numbers for new grads, and it's a you know, I think at some point our profession is going to have to figure that out a lot better than we have so far, and I think it'll be something great that guys like
yeah.
you are involved to help.
You know, again, by the way, I want to say my total tuition first year was 1,200, second year 1,500, 1,300, third year was 1,800. So my
Mhm.
total, when I say total, I'm talking about to graduate was
Yeah.
5,000
Yeah.
because I
Yeah.
only went 3 years. I was the last class to go 3 years at SIU, thank God. And but no, I know that the audience is well aware that not everybody in the world appreciates Heartland Dental, but on the other hand, um, I think we offer a tremendous opportunity for a lot of folks. And again, what a lot of folks don't get to do, and one of the reasons I love doing an opportunity like this is that I want all dentists to be happy and joyous and successful. It'd be great for everybody. Uh, I just know that there's a lot of folks who have concluded that they'd be better off having somebody else help them with different aspects of their practice. And that's what makes the world wonderful is that we all get to make choices. And I think that's all I'd say.
Well, you're looking at, as you mentioned earlier, graduates who have been in profession for 10 years or less, the majority are in a DSO now. And whether it's economic forces or whether it's wanting that, non-clinical support and administrative help or whatever it is, but you are seeing a growing number. One, you're seeing a growing number of DSOs, and two, you're also seeing a growing number of practitioners not being solo docs. Obviously, I'm a solo doc, and I feel like I'm
I'm
a
here.
dinosaur. I mean, you come out, and at one point in time, you wanted to hang your shingle, kind of like what you did from the get-go, and practice. It's a hard thing to do now. One with cost of equipment, cost of supplies, cost of everything. Kind of what trends are you guys seeing going on? Are you seeing obviously the continued rise of the DSOs, the continued rise of docs affiliating? I know you guys have a couple things. I'm gonna ask a bunch of questions all at once. I know you guys have
I got
a
lots of
couple.
answers.
That's right. I know you guys have a couple of different channels where there's affiliations and there's de novos. Are you seeing affiliations rise and de novos decrease? Or are you seeing more de novos that you guys are doing? What's going on with what you're seeing?
I'm going to go, and if I miss a spot, trust me, I didn't intend to miss it. It's a political season, and you ask any question you want, and they give any answer they want. They're just not correlated.
That's right.
Um, but we do de novos because we can predict our growth in that regard, and we go like this community, this growth rate in this area over the next 30 years. This is a good place for a dental office, and then we can count on. And we do about 100 a year right now, which means we're going to need to
Wow.
hire a couple hundred, 250 new doctors a year net just to staff those up. On affiliations, we look at lots and lots of practices and have for decades. What's that mean? Well, it does mean that we do have a pretty good insight into what's happening with revenue, cost pressures, declining margins. We have a very good idea what people are paying for supplies as a percentage of revenue, for labs as a percentage of revenue, labor as a percentage of revenue. We have an extraordinarily good idea at the end of the day what people are getting paid and reimbursed from insurance companies. And we sit here and just say, we shake our heads and say, I feel so sorry for many solo practitioners who are out there beating their heads against the wall, working alone to maintain their independence. And I go, independence from what?
Mm-hmm.
So that you can continue to get ripped off by the insurance companies, by the supply vendors, by people that we work with and have good relationships with, but technology and so forth.
Yeah.
We were looking at an affiliation once and go, I got to be careful how I say things in the right way. I
Are you ever
wanted to,
careful?
I want to do clear aligner therapy, but the scanner is $58,000 and the cost is $1,800. And I'm going, well, we wouldn't be doing it either if that's what the
Yeah.
thing cost. But we're probably going to do 50,000. Our doctors, support doctors, do 50,000 cases next year because the pricing is better. And what we've learned is that there is a lot of training required to learn how to do that and communicate that and handle that. But that's where you go. A community can help you
Yep.
learn how to set up better ways to treatment plan. There used to be the term called mid-course corrections, but how do I handle this now? And compliance isn't what we want. What do I do? If you're on your own, the most prudent thing oftentimes would be to say, I'm never going to start that journey. I'll be
Sure.
fine.
Mm-hmm.
But if you had a community of hundreds of people who only cared for your success, wanted to help you in any way they could, you'd have more confidence to learn how to do that. And it's hard to become an expert or develop expertise if you don't do the first 10 or 15 root canals or extractions or Invisalign cases. And so there are more people of all, historically, when you're 65, you sell your practice and you walk away.
Mm-hmm.
That's classic. Well, that's nice. We can't do that because, we need a transition to us. And so we just don't do that. But we also tend to be able to pay more money than what a younger $500,000 in debt new graduate could do.
Mm-hmm.
Well, there's trade-offs to everything, and I'm happy for whatever makes people happy. But in the long run, people who really investigate let's say, I can only talk about us. What we do, we're not perfect, but our batting average is pretty good. And they come to realize that it doesn't help us if it doesn't work out good for them. If it doesn't work out good for the doctor, well, you're here, but your friends won't be. And our goal down the road is to be able to be available for whoever wants to come and join our network and be a part of our supported offices.
There's a practice right down the street from where we are right now. That's a supported office of you guys in Charlotte. And I was talking to the doc's former partner, and he said, one of the things that, he was scared of is his mentor couldn't sell his practice and just had to walk away. And he didn't want that to be something that happened to him. And then he also had a facility that had more space than a single doc could use, but he didn't have the cash to invest at this point in his career to upfit that, to look at bringing on an associate, to growing the practice. And when he kind of came to you guys and you guys reached an affiliation agreement, he said one of the big things was that you guys were going to help with the upfit cost, with help getting him an associate, with help growing the practice, which kind of leads to all the growth opportunities that the practice will realize from being an affiliated practice versus him being just kind of on his own. And I'm sure, that's a really positive thing that, like you said, a lot of people think that, Heartland is this and Heartland is that. I think, as you said, Heartland is a good opportunity for a lot of people. Solo practice is a good opportunity for a lot of people. You can't be everything to everybody. But you got to be, you got to be what you think is kind of the right thing. And kind of with that, why do you think it's a better choice to affiliate than to just go it alone? Is it the community, or what do you think?
Well, we all have our own personal, I'm trying to think, abilities, awareness of our abilities, and the realities that we face, and things that I hear a lot would be that, well, now I'm a solo practitioner and I'm doing very well. So why would I sell? Because if I do, then I'm obviously going to make lesser money because the people who I sell the practice to are going to probably try to get paid for what they do or so forth. and they go, so why don't I just wait till I'm 65 and sell it for the same amount of money and walk away? But I'm going, now there's a couple of things here. First of all, nobody can predict whether they're going to develop a healthcare issue. Most people can or cannot predict whether they're going to get a divorce. Nobody can predict whether we're going to have COVID or higher inflation or a hygiene shortage or all these things. And so at some point in our lives, we start to calculate, what are we doing and why are we doing it? And all I can say is that we have, again, you heard me say, we're not perfect. We said that. I think our affiliations that work out 90+% of the time, which means we can go out there and find a lot that didn't. But when they don't, it's not because Heartland benefited because it didn't go well. We were at a meeting a couple weeks ago and they go, what do you mean that the doctor sold and never showed up the next day? Oh yeah, no, they did that. And why would they do that? Well, you have to ask them because they felt they could just inflict pain on Heartland, and we closed the practice and wrote off $1.5 million, and we all had fun. and it was outstate New York, and the wife was the practice, and we called third day and asked, hey, how's your husband doing? Is he going to show up and come back? We've never had a day work here. What are we doing? It's like, I am not going to violate HIPAA and tell you about your employee. I go, that was about your husband. Well, so she's an employee of the practice. I'm not serious. That's how it went down. And so we wrote down $1.5 million. Now, nobody wants to publish an article about that. But if somebody allegedly says that somebody said we did something, hired or fired their team, everybody will believe that. But it's like, you just have to give us credit. We're not that dumb. And so they work out 90% of the time. And what we find out over time is that a lot of times, the money that you take off, if you put that in the stock market over the last 5 years or the last 7 or the last 10 or the last 20, is not worthless. And you're not without a job.
Right.
In the meantime, you're surprising what you can make. And then they find out almost every time that they're going, oh my God, I would be getting reimbursed at a different rate for doing the same work. And I'm going, we'll do a lot of work for you if you just give us contractual benefits that we're going to provide for you. You're in the same spot. No matter what we take out of this, you're in the same spot. We're just getting it from other sources. You're just donating that money to somebody else. And they can't necessarily believe that. But and again, it's not always the case, but it's that case quite a bit. And so the doctors oftentimes come to realize that their life gets better when 5 o'clock comes, and whatever challenges we've had with the hurricanes recently and things like that, they go, Heartland has a facilities team that handles that. Now they may need them to come in and say, could you just make sure there's not water on the floor or leaks or something like that. But when it comes to arranging all the contractors, our folks handle that.
Oh, wow.
When it comes time for your annual, hopefully annual increase from your insurance company, Heartland handles that. You just all of a sudden get notified that, by the way, your rates are going up 3% this year. Hope you're happy. And so again, while we're not perfect, a lot of the things that they're most worried about don't come to pass. In the old days, it was like Rick Workman did your treatment planning. I mean, think about that.
Yeah.
We're over 3,000 doctors now. Okay, your dental assistant's doing your treatment planning. And I go back to, and I just remember, we're a little zany and crazy on certain things, but we're not as stupid as people think we might be, because as a dentist, I don't know a lot of dentists who are looking for a dental assistant to tell them what to do clinically. You just have to give us the credit to realize that that'd be stupid and fatal for us as a company. And so that's not how it is. We're not perfect. And if you routinely decided in the middle of the day, just cancel the rest of the patients, screw it, I'm going home. Well, that's probably not a great work environment. Now, a solo practitioner can do that.
Yeah.
That's a wonderful thing about owning your own business. But if you owned your own business,
You'd never do that.
You wouldn't have your employees closing your shop down on a whim for just no good reason without saying,
Right.
hey, was that a once in a lifetime deal? Someone who was sick at home and you had to go. We get that, but
Yeah.
it's a sunny day and we thought we'd just take the day off. Anyway, you
Yeah.
get my point. There's give and takes.
You mentioned, hygiene staffing issues. Obviously, we all face it. Are you facing the same challenges that like he will be facing, that I'd be facing, or because you have the support system that you have, are you able to get hygienists easier, and are you able to fill the need better than a solo doc can?
I would say I don't know that we get them easier because we invest when we get any employee, we tend to invest a lot of money in training them, doctors, hygienists, and everybody, and BAs and so forth. And so,
Sure.
then have to figure out how to train them myself. So, but about a year or so ago, there's a national shortage in hygiene. And by the way, we've partnered, I think you can read this, but we partnered with Concorde University to start a dental hygiene school in Fort Myers, Florida.
Oh, wow. I did not know that.
Yeah. Because we're tired of being without hygienists down there. I think there's going to be other companies that do these things because we can wait forever on our government to fix our problems.
Or we can try to fix them ourselves.
Or we fix them ourselves.
Yeah.
You take 1,800 locations and have the hygiene department be on average up 10% over last year is pretty good. And we think
that's fantastic to be able to have that,
And so they're paying for themselves in our minds.
And for me, it was, I'm a solo doc, me, two hygienist, an assistant, and front desk. And one of my hygienists, she's young and wanted to live in New York City, which, awesome experience to have at a young age. But she left me November 2nd of last year, and it took me until October 14th of this year to find a full-time replacement. Now, there are entities that help you get temporary and fill-ins, and I think we all know the pluses and minuses is about as nice as I can say about that experience. But yeah, I think it's phenomenal what y'all are doing with helping that, add to the number of hygienists that are coming out. There's some folks in North Carolina that are doing the same thing to try to increase enrollment and stuff. But it's, it's still, you start tomorrow. That's 2 years down the road that you're getting a graduating class out.
Yeah. This is where I think I do wish that all of us in dentistry could work better together on workforce. Even I will say that even some of what I call our haters realize that us putting a school in Southwest Florida would simply fill the basket up, and eventually everybody would have more hygienists available. And we understand what supply demand means, and to the extent we can get higher supply, I'm happy for everybody to get paid fairly and well and be
Definitely
good and everything else. But scarcity of healthcare, you can't get in. That's no good for anybody.
Yeah. I think it's great. Like, we've talked about all the stuff that you and Heartland are doing for folks, out of school or earlier on in their career, later on in their career and things. But I think, to a certain degree, what doesn't get enough attention is all the things that you personally, you and Heartland are doing for different dental schools across the country to help, impact dental school education and also, the quality of graduates that come out. So if you wouldn't mind sharing a little bit of what you've done on that end, I'd love to hear it.
Like with Dr. Bell and things like that.
Yeah. Dr. Bell teaches us hard, smart, and together. You got to work hard, smart, and together. Of course, you got to work hard. You got to work smart, but you got to work together. And having you and your team symbiotic makes everything work better. So that's what we do internally with Dr. Bell, and that we've obviously helped certain schools. We're happy to help schools. We want a relationship with schools, but we also want to be able to tell the students and the schools what's happening in their external environment, which is our world. Our world isn't the entire dental world, but for students to graduate and have only been told in their school, whatever you do, don't work for a DSO.
Sure.
I don't think it's fair to the students, because they're going to, again, you heard me say, we're not perfect, but we're not as bad as they tell us some would have us say. And for some students, it's the right decision. They may not know what they want to do. They may need to do a year or two of residency. And, they may stay for a lifetime. They may leave after a year.
Dental education, it's like my view of the news. I think the news should have to present both sides of things and let people make an educated choice from that. Well, we don't see that. Dental education is the same thing.
Yeah.
You see, you have to do it this way. At least when I was in school, and that's the only way to do it. And you can't do it this way. I don't know what's going on now with, obviously, 25% of people affiliating and things like that. So I think being able to have that perspective and teaching that perspective is important. I know you guys very generously have supported, you supported Chapel Hill, you've supported a lot of dental schools, right down the street at High Point. We have the Workman School of Dental Medicine, which is fantastic. Is your goal to help influence the perspective in modern dental education, or just provide support and let the schools kind of just go on their paths, or what is your take on that?
Yeah. And if I don't get all the right details, please follow up. I've loved dentistry. I've been very blessed by dentistry. I tried for a very, very long time to influence some university to put a dental school in my adopted hometown of Orlando, Florida. Florida needs it. 3.5 million people a decade move here. Pretty much the same number of schools they've had for all these years. I'd like for other schools in the University in Florida, didn't say that, to get bigger. We need more dentists because there's 3.5 million people and so forth. When I met Dr. Scott DeRossi, who was at the University of North Carolina, and I met him because of all of our interactions with Dr. Bell, and I contributed to the university, and so they now have the Bell leadership aspect at the University of North Carolina Dental School. And I met Dr. DeRossi, and he stepped down from dean during COVID, and he left the university. He went to High Point University. I didn't know that exactly. I'd heard of High Point University, but I didn't know. But he said, Rick, you need to come down here and meet Nito Quabain at High Point University. I think you guys will like each other. And I go, well, okay, you say so. I'll come down there. And I don't know how many people know or have met Nito, or how many have been on the campus of High Point University. But I'd say I've been a few places and been beaten up enough to where I have a reasonable amount of cynicism or skepticism. But my wife and I went there, and we were absolutely, positively blown away.
It's a beautiful place, beautiful campus.
By the university, by a difference in thinking. They have these innovators in residence. You go down there, and Steve Wozniacki will talk to the people.
Yeah.
When I talked to Scott early on after I made the commitment, he'd ask me, he's like, well, okay, so Rick, you hire hundreds of dentists every year for 20 years. And you spend millions of dollars teaching them. What do you teach them? Why do you do that? And I'm going, I'm not, we don't do this because we're critical of dental education across America. We're doing it because we know in a practical reality, there's a lot of kids coming out of school who've never done root canal, never done very many. They haven't done very many extractions. Almost none of them have done Invisalign. Same for implants and so forth. And they don't know what's possible. And so our job in our minds is to show them what's possible, explain to them you're going to be a dentist for the next 40 years, invest in yourself, invest in your skills, learn how to work as a team, hard, smart, and together with your bell, but put more tools in your toolbox because your patients need these things. It's better comprehensive care. I'm a passionate believer in the super GP model. Dentists can do more than single unit crowns. And we do that. And he goes, you tell me what they need to know, and I'll try to see if they can do that when they graduate. I said, look, Like I've never been asked that question before, and that's not what they're doing. Let's be crystal clear. They're all
Sure.
independent and so
Yeah.
forth. But I said, I'll be honest with you, I've never been asked that. And I
Mhm.
go, well, who in America knows more about what new grads on average need to know? And I said humbly, I really don't know, because who has hired more graduates and spent more dollars training them for more years? And it's
Right.
not a
Makes sense.
criticism. It's just like, let's try to
Yeah.
make them better. They will be better off if we get them what they need. And so we all need more dentists. North Carolina need more dentists. I'm
Yeah.
not anti dentite, as Kramer says, for North Carolina, but you can't look at that growth of that state and say they don't need more dentists. And
Right.
well, half of all the students who go there are from out of state, so maybe 20% of the students will stay in state. But North Carolina is like Florida; it's a booming state.
One of the big things you guys did is you have the ability to bring in the industry leaders in educating in Invisalign. So a affiliated doctor or a de novo doctor for Heartland has that resource to be able to learn. I've
Mhm.
just now felt where I'm comfortable in Invisalign because I'm doing like a molus course,
Yeah.
to be able to really understand. I was like, oh, wow. The reason why that lateral never was the right place, because you have to actually over rotate it 6 degrees, but
Mhm.
it's things that you don't understand. So I do think, you know, that is a great piece that you guys are offering to the graduates. It'd be nice if that could penetrate into the undergraduate education,
Yeah.
possible, or the pre-doctoral education.
But it
We
goes back to that
we think so
community
too.
aspect too, is that thing gives, I mean, we're both doing that program and it gives you a community of docs, kind of like what you're talking about. You'll have that, open threads for all your docs to kind of discuss things and figure that out. And this thing has been a game changer for us.
Yeah.
Look, what occurred, like you're right. We met the best Invisalign teacher, and lo and behold, they became a Heartland affiliated office. And 15 years later, they are a full-time person who's helping with treatment planning and full-time consultant, internal.
Hmm.
What happens because of that? There's hundreds of dentists who are doing Invisalign that wouldn't have otherwise, offering that service, and therefore hundreds of communities who are being served that otherwise wouldn't, or as well, and the doctors and so forth. And it's just, again, it's not perfect. Nothing's perfect. Invisalign's not perfect. I don't
Sure.
think
Yeah.
banded ortho is not perfect either.
Hmm.
But the point is, I think we elevate the batting average, and to the extent that more adults get better occlusion, that's going to be better for perio. It's going to be better for long-term restorative. But if we didn't do Invisalign, they'd get what they've been getting, but they wouldn't be getting better. And so
Sure.
Right.
it's an incremental game in
Yeah.
my mind. It's better standard of care.
So, one thing that I do read about, with DSOs in Heartland in particular is embracing technology. Are you guys utilizing technology to make things more efficient? Are you, you and I have talked a little bit about the AI driven clinical softwares, whether it's Pearl or Overjet, or I can't remember who it was that you guys are using a lot. Are you guys using more of that, using more cone beams, using more? I know you've in the previous have said there's not a lot of in-office milling. Are you guys embracing that, or kind of where are you guys going there?
Yeah. So this year has been a crazy year for us. This year we installed 1,700 the Invisalign, the Itero 5D something
Sure,
something.
yeah.
Hmm.
So one in every office, and manage the change management of all that with in-face visualization and the benefits of that. We installed AI, the video brand in every office. So there's a change management of all of that and integrating that into software, your practice management system. I'll call Curodont technology, but we implemented Curodont early in the process, and Curodont. By the way, if people don't know what Curodont is, it's
Yeah, I don't know what that
Yeah.
is. Yeah.
yeah. Okay, this is good. It's kind of a game changer. Curodont is the first FDA approved product that will take interproximal incipient decay,
Hmm.
and fluoride will coat it over, I call it, and harden it.
Yeah.
But I'm going to be not accurate, so don't hate me on the accuracy, some of your members, but it's kind of an amino acid structure that bonds to the scalloped out lesion, thinking on a microscopic level, and
Hmm.
creates a lattice work that then sucks the minerals out of the saliva, and about 35-40% of the time actually remineralizes the incipient lesion.
Oh,
Wow.
wow.
And it's 93% effective
Hmm.
in preventing further erosion. So the question for your patients is, look, we now have this technology, and it's peanut butter and jelly
Hmm.
with AI, because the AI will show you
Yeah.
what an incipient lesion is and say, now, look, that may not go to a restoration or on into the dentin, but every single cavity in the history of the world that ever became a full cavity through into the dentin
Started
went,
like that.
went
Yeah.
through this phase.
Yeah.
Right.
And we have a product that we can rub on your tooth
Hmm.
by the hygienist that's 93% effective. It's about $100. Do you want to do it or not? You'd be surprised. Between 40 and 60% of all the folks that our hygienists talk to and doctors talk to say yes. And you can figure out how many times per day that might occur in a typical practice.
Oh, for sure.
And so to do one or two of those a day is per hygienist is not unusual, but that's where AI and a technology like Curodont is changing the world. And we kind of joke, but probably we go in 5 or 10 years, most dentists will have heard of this. And in 5 or 10 years, they'll be working on this. But
Hmm.
I'm telling you, Heartland started January 1st when the FDA approval came through. And
Okay.
insurance and Medicaid are generally paying for it. And that's the takeaway to all your people. You ought to think highly about this.
Absolutely. Yeah,
Go
it
for it.
makes sense. Dentistry is the only profession, we like to joke, that actively tries to put itself out of business.
Yeah.
But progression like that and utilizing technology is a great thing. I mean, all three of us will sit here and say the last thing I want to do is a DO on number 18,
Yeah.
or DO on number 19. If I
Yeah.
can figure out a way to put
MO
something in
on
here,
MO on 18, like, oh my God.
yeah,
Yeah.
and never have to do that again, I would
Yeah.
do it all day long.
Yeah, exactly.
And the biggest barrier is always the dentist thinking attitude process. Well, what about the 7% where it doesn't work?
Hmm.
And I'm going,
Sorry.
I
Yeah.
used to worry about that too, but I'm going, I don't know, do the filling, just take that off the filling.
Yeah.
Yeah.
I don't know. And there's people who would criticize me for even saying that. Don't you devalue what we do? They can't guarantee they work. And I'm just saying, a long time ago, took me a while, because trust me, I wanted to be right. I still like to be right. But we have been trained to be right. But the
Yeah.
point is, they're arguing with the patient over this. And I'm going, well,
Yeah.
that's just not a discussion we're going to argue. It didn't work out. And I don't want to change the nature of our relationship over something like this.
Yeah.
We'll move on. And my point is, we've had very good adaptation. But it's an example of one. You were talking about implants. A lot of dentists want to learn how to do them, but they don't know how to do basic oral surgery. And basic endo. And I'm saying, I understand this as a dentist. I understand the desire to learn how to do implants, but if you don't have these skills,
Learn the
you're
basics.
going to
Yeah.
use these skills a lot more than you're going to use this skill. And if you don't have enough confidence to do these skills, it's not the easy ones that anybody can drill a hole and stick a thing in there.
Sure.
Yeah.
What about the complication that could occur in
Exactly.
the process of placing that? You had better to have some pretty good skills, better than basic oral surgery, in case or when you inevitably have a complication with something like an implant. And so we have doctors who do all that and work through that. But there is a process by which you can earn the right by doctors deciding that your office is entitled to a cone beam, because you actually would engage in services where
Sure.
often enough that it
Hmm.
justify it.
Yeah. You got to walk before you run. And
It seems to me like that.
Yeah. Well, Dr. Workman, thank you very much for your time and being with us. kind of my last question would be, are there any takeaways that you have, takeaway messages for our audience? And is there anything that you can think of, any advice that you can give docs to make dentistry a little simpler?
Yeah. Well, commit to becoming better. I mean that sincerely. It's easier for dentists to commit to becoming better at a technical skill. Dr. Bell teaches us, of course, you got to have your technical skills. In the middle of the base of the pyramid is your work ethic, which is, are you willing to work hard and long, but also are you willing to be present when you're at work instead of at work on the phone, on TikTok and blah, blah, blah. And then the third thing is at the base level of your skill pyramid is your personality and leadership skills. And to at the base level, you have what you have, but do understand that when you one of my practice, my first partner, he sent me a text earlier this morning. His practice hit $1 million in October. That's a nice month for a single practice.
Wow.
I said, who do I call and who do I thank? Because I want to do that. But he doesn't even practice anymore, but he's working with everybody on the leadership skills, because you just have to trust that to develop those leadership skills, the doctors in the practice have to be in sync with the hygienist, with all the folks who are then in sync with all the patients. And it's that personality and leadership and communication skills that really ultimately changes the game. Learning how to cut a crown prep a little faster will make a 3 or 5% difference in your practice. But when you learn how to communicate, work hard, smart together as a team, that's when you double your practice. And then they could triple your practice. And I would say to dentists, they go, well, I couldn't imagine 3 times the work, 3 times the stress. And I'm going, well, that right there is an example of where you haven't thought this through, because do you really think that they have 3 times the stress? They're working on it where their teams are all they're highly trained and they're doing what they're supposed to do. Mm-hmm. And you, like as the pilot running an autopilot, are just there to make sure we're still on track and it's all doing well. And yeah, you got to sit down, you got to do your drilling out, do your thing. But that to me is my 44 years now of experience tells me that's something that most dentists still haven't seen, that the highest level, lowest stress, highest level of productivity is when the system is running the office. You design the system, you always are in control of the system, but you put that system in, the system runs the office, you run the system, and things just work. People show up, people say yes, and you do your work. And that's a message I'd love for every dentist in America to understand.
That's fantastic.
Well, thank you again. We really appreciate it. Thank you for being a part of this podcast and for everything that you've done for the profession. We kind of always say that dentistry is a hard profession. Together we can dare to make it a little more simple.